Yes, hello, my name is Colleen Kissel, and I am the founder of the Pediatric Oncology Treasure Chest Foundation. 20 years ago, my little boy was diagnosed with leukemia, and that was my inspiration for starting the Treasure Chest Foundation. Seated with me, I am with Jennifer Torres and her lovely daughter, Mariah. And Jennifer is the mother of 3 girls, and one of which was also diagnosed with cancer like my son Marty. And this is Mariah. And Mariah, how old are you?
7.
Okay, you're 7 years old today. And I understand that you were diagnosed with leukemia at the age of 6 years old.
Mm-hmm.
So I'm going to ask Mommy about that, and then we'll ask you a couple questions, okay?
Okay.
So, Jennifer, can you tell me about the diagnosis, like what was going on when your daughter was diagnosed?
Absolutely. So when she was initially diagnosed, we were told that the doctors were 99% sure that she didn't have anything fatal or serious. Now, she had fevers of 105, and we thought it would be something viral. When we brought her into the emergency room, they did all kinds of tests and could not figure out what was wrong with her. By day 5, she still had fevers of 105, and basically at that point they did a bone marrow test, and that afternoon on a Friday they confirmed that she did have leukemia, or it's actually acute lymphoblastic leukemia, which is one of the main types, and then there's also subtypes as well. When we found out that she actually did have leukemia, we were very grateful to find out that she did have a subtype that was more treatable, and thank God that she was a child, and obviously with children, it's more treatable. So,
Yes. I remember when someone said, "Oh, you're lucky, you have the best leukemia."
yeah, and it's like, how can you really?
Right, and in the moment you don't understand that, and as time goes on, you realize this is a good thing.
Yeah, absolutely.
And now I can recall my son. He was as white as a ghost, and he was bruised. I mean, looking back, did you see any signs prior to that week?
Honestly, now that I think about it, I did. She was quite pale, and she also was very bruised all over her body from her, I believe it was her white blood count being low, and also there's different type of, things that they look at to determine, the reasons why they may have the leukemia. But yeah, that was, now that I think about it, yes.
I know, and I thought my little boys were wrestling too hard, or it was February and there wasn't any sun, and so, but yeah, I guess we can all look back and notice those signs, but in the moment you would never think leukemia.
Yeah, absolutely.
So, okay, so what was your reaction when how were you told that news?
So I remember Mariah being in a hospital bed. I was there with my husband and his brother. The doctor came in and told us, she kind of had a big smile on her face, and I was thinking, okay, she's fine. It's something, that's not serious. And they're like, well, can we talk to you for a moment? So they pulled us into the other room, my husband and I, and basically told us, your daughter has leukemia. And I just bursted out crying. The first thing I asked was, is she going to die? Because people who don't know about cancer think right away, you hear cancer, you hear about death, and that's the most scariest thing that you could ever think of, possibly, with your child.
Yes.
But yeah, that was basically how it was done.
And I'm sorry that this doctor walked in with a smile. I mean, how inconsiderate. I mean, some of the things that happen in this journey. So you said that your daughter had leukemia. Can you tell me a little bit like what the treatment is like? She's still going through treatment. Can you tell me a little bit about
Absolutely.
the treatment?
So she's a little bit over a year into treatment now. At the beginning, when we first started, she was going like every week to basically just get chemo, also to make sure that her blood counts, including her red and white blood counts, were all up, on a good level, because if for any reason those were to drop, she can get sick very quickly. So basically, in the beginning, it started off at 1 week. Every week we would go for chemo, and she would also take pills and things like that, during the day and the weekend as well. As she's gotten a little better, she's now in maintenance phase, so she's actually going to the clinic twice a month, and is also getting spinals, which is basically chemo through her spine, and also through her port every 4 months now.
Oh,
So it's gotten a lot better, I have to
Yeah.
say.
yes, the beginning's dreadful.
It sure is.
I recall 3 or 4 times a week. I mean, back in the day, this was 20 years ago, my son was hospitalized, and I know now today they do everything outpatient.
Mhm.
So I guess that's a good thing. You
Yeah,
know, the kids get to
absolutely.
go home. So, okay. And can you tell me about the clinic where your daughter's being treated?
Yes, she is actually being treated at Advocate Christ Medical Center, which is Hope Children's Hospital as well. And basically, her clinic is amazing. They do a lot of different things with the children. They also have a child life program, which allows the children to play games or have someone come in and kind of basically make them feel better on a day that they're not, expecting to feel that well. Kind of takes their minds off of things. So it's a really awesome program.
Okay, good. So I could tell you about a time, I don't know if you've experienced anything like this, but there was this 21-day span where Martin developed these mouth and throat sores,
Yes.
and he was on a feeding machine, and he was hospitalized for, I want to say, about 7 days. He couldn't eat.
Mhm.
And I'm telling you, I thought, this is it, we're at the end. But he recovered, and did you guys ever experience any dreadful setbacks like that?
Yes, we actually had one day in particular, 1 week, where she had those sores as well. I think it's kind of a common thing with the chemo and not wanting, little children not wanting to brush their teeth all the time because they're in the hospital. I mean, and their mouth is sore, whatever the case may be. Sometimes things get worse in there. She did get to the point where she's in the hospital for 2 weeks and couldn't eat. And was getting fed by the bags, by the IV and all that stuff. So yeah, that was definitely one of the darkest days. In addition to obviously the day that we found out she was sick, thinking that something wasn't seriously wrong when it was.
And they say there's a fine line. If you don't give enough chemotherapy, the patient won't be cured. And if you give too much, you end up, with the mouth sores and
other issues.
So, but I feel in the long run it paid off. I mean, but yeah, that was one of my darkest days also. And so, if there is a good side, I maybe going to the clinic, or what is one of the best things about going to the clinic or the hospital?
Honestly, to be honest with you, the Treasure Chest Foundation is one of the best things that has happened to us.
Well, thank you. I'm going to ask you about that in just a minute.
Yeah.
So thank you very much for that response. That's for our donors, but we'll talk about that in a minute. I met myself, I remember when my son was diagnosed, like the doorbell wouldn't stop ringing with people bringing food and presents. And I mean, it just seemed like all the people that maybe we might have taken for granted were so in our lives. And what about your friends and family? Like, what was their reaction?
They've all obviously been very upset about the whole situation, but they've all been here for us very much, and I've always tried to help, whether it be babysitting or financially or just being here for Mariah when she's in the hospital to give my husband and I a break. So yeah, I have to say family has been one of the #1 things that have helped us through.
The reason I've asked you both to come here was to help get the word out about how valuable the Treasure Chest Foundation is. I can tell you one thing about my little boy. He was your age. He was 7. He never had a sticker or a sucker. Can you imagine that? After all those spinal taps and all those bone marrow tests and all that chemo. And so anyway, that was the inspiration. His experience was my inspiration for starting the Treasure Chest. But can you, we'll start with Mom and then we'll talk to you. Mariah, Mom, can you tell me about the Treasure Chest Foundation at Hope Children's Hospital?
Sure, absolutely. On days that Mariah is at a regular clinic visit, just to visit or to check her blood or whatever the case may be, there is the treasure chest that she's allowed to go into and pick out a small toy. And then if she has a long day of chemo or whatever the case may be, blood transfusions or whatever, she's able to go into the toy closet, which is a larger toy. And that's something that she looks forward to in both aspects, because it's just something to look forward to after a long day, or after a hard day in general for her.
Right, because we sort of set it up that way, where if it's a smaller procedure, like a little blood test, then you get a smaller toy.
Mm-hmm.
But if it's the big guns, like the spinal taps or the bone marrow or the chemo, then you get to go to the toy closet with the big toys. And we had some Girl Scouts bring in a lot of big toys today, so you can look them over. But anyway, so Mariah, now it's your turn. Can you tell me about the treasure chest at Hope Hospital?
Well, I like going to treasure chest because there's a lot of the toys in there, and I like the toy chest because I get to pick toys out after I don't feel well, even if I don't get a bone marrow or spinal tap.
You make me almost want to cry because you shouldn't have to go through any of that. But at least you get a little bit of a prize,
Something
right?
to look forward to, yeah.
This is when I met you. I don't know if I'm going to show this to the camera, see if they can pick it up. But this is our little Mariah. And this is the day I met you at Hope Hospital. And I asked your mommy if I could take your picture. And you've been a joy in our lives. I mean, you're one of the Treasure Chest Foundation family members.
Thank you so much.
So, no, thank you. And we've showed this picture to a lot of people, and they brought a lot of toys ever since they saw that picture.
That's wonderful. We really appreciate it, not only for us, but also for the other children that have to go through it. Because we do see a lot of other children go through it every day, and children that are new, that have never been there before, don't know what to expect. So, but the Treasure Chest Foundation is something that they can look forward to in the future.
Yeah, and I think you hit it on the head with the families. Like, you seem to, I recall going through the treatment for 4 years with the same group of people.
Yes.
And these kids, they grow up together, and we're always in the clinic together, and they just really become like family. And,
Yeah, we do.
and then you see a new one come on board, and like you just said, at least they don't know what to expect, but at least the little one will be rewarded with a toy gift or gift card. So
Absolutely.
yeah, so did knowing your daughter would receive a toy help you? And
It did. It actually, when we first found out, it was like an unbelievable perk that we didn't expect. We're like, okay, well, what else is going to go wrong? What else is going to go wrong? And finally, when we found out about the Treasure Chest Foundation, actually the day we found out, we were leaving the hospital on the first, I think it was the week that she got out after she had received her first set of chemo. And she actually got a guitar, and she was so excited.
she got a guitar.
She sure did. She was very excited about it. So it gave her something to look forward to in the future.
Yes. Now, what if you went there and they didn't have any stickers or suckers or toys? I mean, that's what it was like for Martin. Can you imagine what that would be like?
Having to go there a long time ago. It wouldn't be fun, would it? Not at all. Nothing to look forward to.
Yeah. So sometimes in the morning, if Mommy says we have to go to the hospital, do you ever think, okay, I can do this because I'm going to be able to pick out a toy?
That's the reason why she wants to
There
go.
you go. There you go. I heard of a little boy begging for a spinal tap. Can you imagine? He told the doctor, I want a spinal tap because I want to go to the toy closet. Oh.
At least it gives him, like I said, at least it gives him something to look forward to.
And, okay, Mrs. Torres, can you elaborate on maybe, and then we'll move on, like one personal story about your daughter and the treasure chest or the closet?
Yeah, so let me think. Okay, well, I'll give you this one. The day that she got, I think it was maybe her second or third spinal, she went into the treasure chest, into the closet, and actually got a toy out for her sister.
Oh.
And it just, it gave her something to look forward to, just because she's such a giving person. Even though she had went through that whole procedure, she got a toy out for her little sister, and her little sister was so excited. But the point is that she still got to do something that she, wanted to do because she likes giving. She's a giving person. So, yeah, that's one of the main stories that I can remember, that she got her a toy for her sister, even though she went through procedure.
I think, to me, I notice the kids are, as much as they go through, they're just so loving. They do better than mom and dad.
Yeah, they do.
They're just so loving and caring, and they think about their brothers and sisters all the time. And, I mean, that was so sweet of you to do that for your baby sissy. So good. Okay. Oh, good. Well, that's the thing about the Treasure Chest Foundation. We don't turn down any siblings. If they are there, most of them are probably in school, but if a little one comes with, we don't turn them down because the whole family goes through or is suffering.
We appreciate that as well, because there is three children in our family.
Yes.
So with Mariah coming home all the time with presents, even though they understand what she's going through, but they don't. It's still nice for them to be able to at least get a toy as well.
Yes,
from the toy box.
Good. All right, so Jennifer, what would you say to a family that just learned their son or daughter was diagnosed with cancer?
First of all, I'm so sorry that you have to go through this, but there is a light at the end of the tunnel. There's something to look forward to as far as procedures ending, and also definitely the Treasure Chest Foundation in general, something for the children to be able to look forward to at the end of the day.
Good, thank you. And a couple more questions. What would you say to the contributors, the men and women and the Girl Scouts and the Boy Scouts, the people that open that door all day long bringing toys in for the little ones?
What can we not say? We're so grateful for everything that they do for us. It's something that we really appreciate, and not only us but our families, and also the other children that are going through it. I'm sure they appreciate it just as much, but as a family speaking for everybody, I have to say we are so grateful for everything that they do for us.
Good. Okay. Now, someone once said to me, Colleen, this will change your life for the good. And she was a mother whose son had leukemia, and he was all grown up and running on his way. And I thought, how can you say that? But I so understand today. I mean, the value that I place in people versus things. I mean, how do you feel? How has this changed your life?
I have to say I definitely appreciate everything more. Every little moment that I'm able to spend with Mariah, and also her sisters, or everyone in general. Everybody is not promised tomorrow, so it makes you really realize how precious everything is and how much time really goes by fast.
Yeah, that's for sure.
Mm-hmm.
Okay, so do you have any final comments before I talk to Mariah?
No, I think that's pretty much it. All I can say is we really appreciate everything you do for us, Colleen, and also for all of the donors and people who help every day, and volunteers. We really appreciate it.
Thank you for giving up your afternoon to do this for us.
Absolutely, sure.
All right, I'm going to talk to the little one over here, my favorite. I think you are my favorite little one, too, ever since I met you at Hope Hospital that one day. Okay, so I was going to ask you, you said you're 6 years old? 7. Oh, okay, I'm sorry. You were 6 years old when you were diagnosed. So do you remember when Mommy and Daddy used that big word, leukemia? Did you know what that was or what they were talking about? No, I know. How could you? So I would like to ask you about one of your favorite toys. What has been one of your favorite toys from the treasure chest or the closet?
The drawing set that I got from the closet.
The drawing set? Okay. And are you an artist? Do you like to color or draw? Good. I bet that helps out when you're sitting there all day long.
Gives you something to do.
Yes, exactly. We have the ladies in the back, they make gift bags with coloring books and crayons, and they make them just in case you have to sit there all day long. So when you go back there, you be sure to say thank you.
Oh, yes, absolutely.
They'll probably give you one to take home, sweetie. So I really thank your mom and dad for coming in. I'm going to talk to your dad, but is there anything, Mariah, that you'd like to say to the people who bring all the toys to the treasure chest? What would you like to say?
Thank you for donating all the toys for all the sick kids.
Oh, wait, I'm going to ask you to look at that camera because we're going to show this to all the donors. Okay, what would you like to say to all the people who bring the toys?
Thank you for bringing all the toys for the sick kids, and it really makes us happy to look forward for something at the end of the day after we go to the clinic.
Oh, Mariah, that is beautiful. Thank you very much, and you can go back and pick out something to take home. Okay?
Thank you very much.
All right, well, thank you. Okay.